Hello and welcome to today's episode of Health University, where we talk all things fertility, pregnancy, and perimenopause, the lessons that we learn through life on every step of this journey. And today I am honored and overjoyed to have with us Barbara Collura. Am I pronouncing your last name properly, Collura? She is the principal and founder of Vital Voices Consulting, LLC, a firm dedicated to providing strategic consulting and infertility advocacy for organizations, companies, and innovators who share her vision of family building for all. And the name of this podcast title is Once and for all caps. Barb served as the president CEO of Resolve, and this is how I know her and have come to love and admire her, the National Infertility Association from 2007 to 2025. That is quite a dedication of service. She is a nationally recognized expert on infertility and the family building journey, with a special emphasis on advocacy, public policy, and access to care. And that's also how I know you, because I'm through the advocacy component of Resolve that you founded. She's worked with the World Health Organization on infertility definitions and clinical guidelines, worked with ACOG on their clinical definitions for infertility, and served a 4-year term on the Advisory Council of the National Institutes of Child Health and Human Development at the National Institutes of Health. She is routinely quoted, and it's true, in major media outlets including New York Times, Washington Post, USA Today, and Politico, just to name a few. That is not exclusive, on a variety of topics related to infertility. In 2014, she received the Distinguished Service Award from the American Society of Reproductive Medicine, of which I'm a member. And she was recently named by PR Week to the Health Influencer 30 class of 2024. So forgive me for having to turn to the side. It is such a replete bio. I wanted to make sure I got it all. Welcome, Barb. Thank you so much for joining us. This is an important conversation we're about to have. It's an important week to have this conversation. And this episode will be airing. I'm splicing it ahead of the others in the queue because it is so timely. So thank you for coming. Thank you for joining us. And please tell us, what is your impression? How would you describe Vital Voices Consulting LLC and why it's important right now?
Well, Dr. Susan, thank you so much for having me. It is an honor to be here as well. And I know that you cover so many different topics. To veer a little bit off the medical into this side of it is exciting. And I'm really glad that you reached out, and really just an honor to be here and chat with you. So, I founded Vital Voices Consulting, and it's so interesting. You said, in this time. Well, I certainly didn't really, realize all of the various components that were happening in our country. But of course, I've been very much a part of it at Resolve. I left Resolve in June of 2025. So I was leading Resolve when the Alabama Supreme Court happened, and when candidate Trump announced on the campaign trail that he was going to cover IVF. So some of the biggest things in our field, I was very much involved in. And there's really a couple of things that I see. I believe in the power of engagement. I
100%.
believe in the power of raising our voices. And call me naive, but I believe in the power of public policy.
That,
And I see how it changes lives, and for the better or for the worse. And that's really important,
mhm.
because I have a friend who's been a lobbyist and worked in Capitol Hill, and you hear this phrase all the time. If you're not at the table, you're on the menu, right?
Mhm, mhm.
So, in other words, they're gonna eat your lunch
Yeah,
if you're not at the table.
yeah, yeah.
So these are all funny little sayings, but it's true.
Yeah.
And so if we as a patient community, if we as a physician community, if we as a ecosystem of infertility community aren't showing up,
Mm.
we are not telling our stories, guess what? Things are either Two things are going to happen. Either nothing, and if you like the status quo, then great. I don't.
Yeah. Well,
And I don't know.
nothing devolves to nothing.
Yeah, been saying for 20 years the status quo is unacceptable.
Hmm.
The other option is change happens, but it's not good change
Hmm.
in however you define that. So if you're not at the table, those are your options. If
Hmm.
you're at the table, guess what? Something's going to happen, and you have a lot more influence and you have a lot more say. So I want to help the field. I want to help primarily companies
Yeah.
who have been on the sidelines, and I don't say that in a negative way or a judgmental way, but they've made choices to be on the sidelines. And let's face it, people look at politics and they're like, stay away,
You're
right?
right.
Are you
Right.
kidding me? It's the last thing I want to get involved in. Yet, I think if they understood perhaps what some of the maybe even baby steps or bigger steps, how that could benefit their companies, how
Exactly.
that could benefit their maybe their customers, their clients, their patients, whatever they are, and let's be honest, the ecosystem at large. So I see just a huge, it's almost like I see this potential, right? I see this army, good army waiting, but no one's really organized them. No one's really told them how to get their armor on or how to hold the sign.
Mhm.
And I want to do that.
Yeah, amen. And you're right. I mean, the companies, corporations have engaged for the most part to the extent that they have been asked to engage, perhaps. So they're offering perhaps fertility benefits, and then it's done. And so there's another company, an insurance-based company, that's basically covering claims. That's not full advocacy for their custom. I mean, for their employee, because their employee needs a lot more than claims benefits reimbursed.
Yeah, I mean, there's
Mhm.
so many layers that you just brought up another layer, which is, I'm looking at the hundreds of companies in the fertility space, but then you look at just our economy at writ large. How are we showing up
Mhm.
for people who want to build their family? That's another area of tremendous advocacy. And Susan, what's so really incredible about that is that oftentimes that's a bottom up, that's employees advocating, right? So
Yes.
so I'm looking at the companies that might be on the sidelines, but there's a millions of people, right, who are perhaps on the sidelines.
Mhm.
And how do they advocate to their employer? How do they advocate to their legislators? How do they advocate to their friends and family?
Mhm.
So, I take a lot of look, advocacy, no one's creating this from scratch. They look at what everybody else has done, right?
Successfully. Mhm. Mhm.
And no, and I'm no different. I mean, you look at what breast cancer, I mean,
Mhm.
my grandmother was passed away from breast cancer in 1979,
Mhm.
and people thought you that it was contagious.
Oh wow.
People wouldn't talk to her in the grocery store,
Oh my
right?
goodness. Oh.
So think about where the breast cancer movement, and a lot of people today weren't around for that,
Mhm.
and seeing how that has changed is
Absolutely.
unbelievable.
Absolutely.
Um, Mental health,
Yes.
the AIDS epidemic. I mean, we could go on, and there are a lot of amazing health movements that look, if every single person who had breast cancer kept it to themselves, do you think we'd be where we are today?
Not at all. Not at all. We'd be where your poor grandmother, rest her soul, is, where people would be avoiding making eye contact, and suffering in isolation.
So that's what I take solace in is that we have had a culture in our country of advocacy of people of like-minded people coming together and making a difference. We're no different,
Yeah.
right? We're not reinventing the wheel here. We're just doing what everybody else has done. And I have a story that I'm a little embarrassed to say, but it's true. When I first started at Resolve as the CEO, I was in at Resolve in a different role, and then I became the CEO in 2007. And Susan, we used to tell people it's okay. You don't need to speak up. You don't need to advocate. Resolve is here. We've got your back. I kind of laugh when I say it because it's quite honestly today in my Barb Collura of 2025, I say that's like the most ridiculous thing I've ever heard of.
Yeah, a little
But
patronizing.
but that was like what we said because so many people were so afraid.
You wanted to provide comfort at that time.
Yes, and we wanted to be like, hey, it's okay. Like, we're your big sister. It's okay. You don't need to share. You don't need to talk about it. You don't need to act like we're here to do that for you. Like, that's our role. And guess what? Like, a staff of what at the time, like five, whatever, we're much bigger now. Like, that's ridiculous. And what we need is millions of people
Right.
talking about it and sharing.
With
And
their own
so,
voice, because we're all each hearing that
exactly.
person's soul speaking through that person's experience,
Yes,
and that's what has us lean in, not a testimonial, not I mean, even the printed word can't do it the way, somebody speaking
100%.
from their own voice and experience can touch us and pull us into action.
Yeah. And now I say to people, I start with, is the status quo acceptable to you?
Mhm.
And you've been in this space, you know the answer. Every patient's going to say probably HEL, no.
Yep.
And and then you say, you have a story.
Yeah.
Your voice matters. I know that sounds trite, but it's so true. Find a way to share your story. And I'll tell you, I'm I'm not going to apologize. I'm not going to say I'm sorry, but we need everybody doing that. And
Absolutely.
there isn't really an opportunity for people to stay silent.
Yeah. And especially now, let's get to the now. In these last 2 weeks or 3 weeks alone, in this country, we have had some big messages coming out of the administration that have kind of like made it been like a bit of a tilt-a-whirl an arcade where the mirrors are going in and out. So let's talk about first the one that was released saying, well, even though we campaigned on IVF for everyone, actually what we're going to do is support restorative reproductive medicine, air quotes, as though that is a thing separate from the IVF and ART, advanced reproductive therapy world. What was your impression when you heard that? I mean, I'm in ASRM, so I heard their impression. There was quite an uprising around that and a reaction around that. But what was
You
your
know, I think I would just want to back up here.
yeah.
So the first time I heard of restorative reproductive medicine was in the summer, early summer of 2024.
Hmm.
And so it was something that, a lot of people now know about, but we absolutely knew what was going on. And it was not from the administration, it was not from necessarily members of Congress, but it was from very influential organizations like the Heritage Foundation and others who this is the Barb Collura version of what I
That's
think
all I'm
happened.
asking.
Um,
Hmm.
so look, after the Alabama Supreme Court, when they said that a fertilized egg or a frozen embryo is a person, you had a really interesting thing happen. We were in the midst of a presidential campaign, and people were outraged. And um, this is why I was PR week, influencer because I was everywhere. The
Hmm.
topic was everywhere.
Hmm.
You couldn't get away from IVF.
Yeah.
And so we had a country that was talking about IVF, and you had candidate Trump who was like, everybody loves IVF. We all support IVF. At the end of, so that, remember, the Alabama Supreme Court was February of 2024. The end of March, I was at a Senate Judiciary Committee hearing where Ted Cruz said, everyone loves IVF. 100% of the Republicans in Congress, we all love IVF. So you had a lot of public bravado around support from IVF. However, behind the scenes, the organizations who are opposed to IVF were like, actually, we don't like IVF. And we need to rein this in.
Hmm.
They had a briefing on Capitol Hill in the early summer of 2024 that was all about IVF. We
Mhm.
weren't a part of that, but it was about here's what's bad about IVF and everything. So then some polling started coming out that said 75% of Americans love IVF and think IVF should be, and it was like no matter who did the polling, it was always like over
Yeah.
70%,
Yeah.
right?
Hmm.
And so now you have data, you have all these Republicans, and you're an organization that's against IVF, you're like, whoa, what are we going to do?
How do we put the brakes on this? Hmm.
In walks, stage right, in walks restorative reproductive medicine
Hmm.
to the rescue. So, what that did, and this is again Barb Collura, what I believe that did is it gave them a way to say, hey, 75% of Americans, we're not against 75% of Americans. In fact, we're so with you that we think this is really about curing your infertility and getting to the root cause of it and having more compassionate care. And gosh, we think you may not ever even need IVF. And so this subtlety started shining through. And my goodness, they gained a lot of traction because here's what happened. In February of 2025, President Trump came out with an executive order about IVF. And boy, talk about, I thought I wrote it. The way the fact sheet and the
Right.
executive
We were
order, I
all
mean, it
so
was
excited.
beautiful.
Yep.
It was
Hmm.
beautiful. It was
Yep.
talking about the numbers and how this is has an emotional toll and health insurance doesn't cover it and we need to do something because people need IVF.
Hmm.
And again, there wasn't anything in that EO that I was like, this is bad. Like I was like, wow.
Amen. Right. I was the Hallelujah chorus was
But
singing. Hmm.
Susan, I started tracking all the organizations that came out with press releases that were aghast at this, and it kept growing and growing and growing and growing. I think I ended up with like 18 or so
Wow.
organizations who were like, this is the worst thing in the whole world. Expanding access to IVF is the worst thing. So, guess what? Now they were really on their heels.
Right. Back.
And the restorative reproductive medicine was pretty quiet in
Right. Right.
2024. And boy, now they're like, now what do we do? Well, what did they do? Really smartly, they um, met up with the MAHA movement, Make America Healthy Again,
Hmm.
and the quite honestly, a lot of the goals around restorative reproductive medicine fit very well with the MAHA preventative care,
Hmm.
that sort of thing, and they worked together.
Hmm.
And they went to the White House.
Hmm.
They went to members of Congress. They got a new bill introduced on restorative reproductive medicine. They created model legislation.
Hmm.
They targeted Arkansas, where the governor is Sarah Huckabee Sanders, well known to everybody, and they got a bill through the legislature in the quickest. There was not a single opposition at the hearing, and the bill passed, signed. They had a beautiful signing ceremony, and Heritage Foundation and a couple other groups took credit because they said this was our model legislation. So, what have they done in those intervening weeks and months since February is get stronger, get smarter, have some wins,
Hmm.
and have the ear of the president.
Yeah. I
Now,
think that's the big one. Yeah.
I just want to be clear there's nothing that the administration itself has said about restorative reproductive medicine. We want to be clear on that. What has happened is the movement for restorative reproductive medicine has been very loud and has outsized influence on the
Hmm.
administration.
Hmm.
So we haven't yet seen the administration say this is what we're going to do. In fact, we thought that the recommendations from that executive order were going to be really strongly for restorative reproductive medicine, and I know you're going to probably get to this. They didn't. They weren't. But that movement has that's my kind of like genesis of it and where I think it came from, and then how it got fuel, if you
I
will.
see. Yeah. Yeah.
over the last, 8 months or so.
Yeah, and this is a peek behind the curtain, right? A peek behind the kimono, or whatever they say. Is like this is how it happens. This is why advocacy is so important because in the dearth of grassroots response, these organizations that are deeply funded, well-oiled machines can just tunnel their way through to legislation. Now, personally, I'm a doctor of acupuncture and Chinese medicine, so my work, I'm not an REI, but so my work kind of falls in the restorative reproductive medicine category. And I've been doing it for 23 years. And my argument is it's not an either or. It never has been an either or. So to create this legislation that it is an either or has only one design in my observation, and that is to make it inaccessible to those for whom restorative reproductive medicine is not going to bring them the realize their dream of family. The people, same-sex couples, single parents by choice, and then others for whom perhaps there's an urgency or a reason that is kind of singular that requires that they get IVF quickly.
I couldn't agree with you
Yeah,
more.
yeah. So
And I have not heard anyone say that it's an either or, other than the restorative reproductive
yes,
medicine folks.
yes,
So
that
your viewpoint is my
yeah,
viewpoint, and absolutely I couldn't agree more as to why that IVF is being left out. Because guess what? These are folks who are very much against IVF. Again, go back to where this started from
yeah.
and the genesis of it, and
And
that
why they
really
are against IVF. Yeah.
that really helps. Yeah,
Yeah.
understand the whole
Yeah.
big picture. And I know this is a lot of like inside baseball, but it's important for us as a community to be aware of, yeah, there are forces out there that don't like IVF. And, I've mentioned Heritage Foundation a few times. Their work is done very well. As you mentioned, they're very well funded. My friend Sean Tipton at ASRM says, "Gosh, I hate it when the people who we don't who oppose us do what they do really well."
Yeah.
And that's what we've got.
Yeah. Yeah. We're happy to share in this and all conversations at Health University, where you are the reason that we bring our experts to each episode. With fertility benefits being offered as part of employee benefits packages, we encourage you to share our corporate wellness program to your human resources or employee benefits director. You can find the link below at healthuniversity.co, note not .com, /corporate wellness. Now, let's resume our conversation in today's episode. And so we barely came off, our heels with this restorative reproductive medicine conversation. And now in these last few days, we have this, kapow of information about, well, now we're going to actually make IVF medications available to everyone because we're going to lower the costs by 84%. And all of that is, again, just a press release, a statement, right? We really don't know the details of that or really what the real cost would be, because it may be that 84% reduction is more than someone's paying out of pocket if they've got insurance coverage. So lots of little threads to pull on that. Yet my comment in this conversation is it's the conversation is getting elevated. So my prayer for anybody listening is to hop on the advocacy train here. However you can begin, and Resolve is a great place to begin. Or if Barbara's inviting you to join forces with her, and then please do that, because we are at a moment now where we can become a real contrast to, or what's the word I want to say, a competitor to the whole Heritage Foundation organization, well-oiled, well-funded machine. Like we are, like now is the moment where we can really shift this conversation and shift this trajectory so that we actually do get what
Yeah.
75% of the population wants.
I so appreciate how you put that. Yeah, so the White House recommendations on their executive order were made public last week or excuse me, on October 16th. And we, I didn't have any knowledge of what they were going to say. I will say that what was announced is not harmful.
Correct.
There's nothing in there that is meant to reduce access to IVF or to regulate the field in a way that's harmful. In fact, none of that came out of there. So let's start with the glasses half full
Yes, yes.
and talk about what are some of the positive things. When you look at this, there were two components to it. One is encouraging more employers to add this as a benefit,
Hmm.
and we'll talk about that in a minute. And the other was reducing the list price from one of the three
Medication.
pharmaceutical companies that provide drugs in this space in the U.S. And
Hmm.
so um, this is a company that is based in Germany. They are their medications are distributed all across the world, and so they had an opportunity to work with the
Yeah,
administration
very
on
smart.
what they called most favored nation status, and say, hey, what do you charge for your drug in Europe? Hey, we want to get that here. In addition to that, they have a drug that's already used outside the U.S. but has not been approved by the FDA, and they're going to get fast tracked. That's the best way to put it, of approval for that drug. It'll still go through the process; it has to be approved, but it's going to be in a process that goes a lot faster.
Mhm.
So, and then they're going to be able to. They said you patients can get the medication through the trumprx.com
Mhm.
portal, which I don't know anything about. I'm
Yeah.
just being very
I
honest.
keep Googling like what is this?
I don't know anything. Like, of course, like you, I've heard about it, but I don't know who's behind it. I
Yeah.
don't know how it works. I don't know if there's a fee that takes. Who gets that? I don't know who's filling your script on
Hmm.
the behind the scenes. How have they negotiated the price? So I don't know any of that. What I do know is that currently the medications that people use for IVF are distributed through specialty pharmacies.
Hmm.
And even if it's CVS, it's through their specialty
Right.
pharmacy. And then there's mom and pop specialty pharmacies, brick and mortar specialty pharmacies, mail order specialty pharmacies. Our space has specialty pharmacies who, for the most part, just fill medications for IVF. Not all, but a lot of them do. They have nurses on call. They have videos on how to take your medications. Like when you get that box of medications, they're right there with you, helping you. And the level of care and, customer service, if you will, from these specialty pharmacies is very high,
Yeah.
right? It has to be.
Yeah.
Um, and
The stakes
so,
are so high. They really have to, give
yeah.
that level of support to the product. Yeah.
And so I don't know how that's going to work with TrumpRx.com. My assumption is that there will be specialty pharmacies who will now negotiate with that
Mhm.
to be a part of that. But I don't know. I
Yeah.
don't think anybody yet knows how
I
that
don't think
works. So
anybody knows yet either. Yeah.
I will tell you though, and maybe you don't even know this, not you, but the patients, is that list price, no one ever pays list price, right? So the specialty pharmacies that you're already getting your drugs from have negotiated, guess what? A very deep discount.
Yes.
And then if you're a patient who has no insurance for medications, so you've got to pay for every medication out of your own pocket,
Mhm.
okay? That the pharmaceutical field calls that cash pay.
Right.
And so if you're cash pay, then the minute you show up, they will say, we have a special coupon for you. We have a special discount for you. They have names for these programs, and you get even more discounts,
Right.
right?
I
In
want to
fact,
just highlight that. I want to repeat that, Barb, because I think that I want to make sure it's something that could have, kind of easily passed by. While the numbers, the percentage discount that we read about 4 days ago is like 84%, it's 84% off list price that nobody pays.
right,
So, right. So,
right,
so,
right,
you know,
right.
grain of salt.
Yeah,
Again,
yeah.
this is
And
not to take
I,
away from that we're here.
right,
Let's make the most of this moment.
right,
But, let's also not say, wow, 84% reduction.
right. Well,
That's
somebody posted, who works with folks that are in the military, that same company, EMD Serrano, and they all do have a special program if you're in the military
Mhm.
and you're doing IVF, and you can get a discount. And she said that it was 75% off of list price. And she said there were still folks in the military who couldn't afford it.
Mhm.
And so I'm just telling you that because these quote unquote discounts have been in existence, the whole time. Do I know the exact dollar, like currently if you're cash pay to this quote unquote 84%? I don't. It could be that 84% is material. It could be that's a few $100s. I don't know. But I think what we want to say is that that was a way to say, hey, we've worked out a deal with this pharmaceutical company, and they're going to give these discounts. So let's take it at face value and
Yeah.
say, okay,
Let's take it at
great.
face value and oops, excuse me. Sorry about that. Sorry, my alarm just went off. I'm not sure why. And then I almost knocked you off the screen. But before I forget my own thought, you had mentioned that the executive order spoke to the discount of the drugs, but it also spoke to the request of companies. And this is where I want to
Right.
come back to because this is
Right. And
our
I
industry.
not to be nitpicky, was not an executive order.
Oh,
That it was like their recommendations from the executive
I
order.
see. Okay.
But because quite interesting that you even brought that up now that I say that, because he didn't make a new executive order.
Okay.
On some other things, and I'll use AI as an example, there was an initial executive order, and then there were all these deals made on artificial intelligence or
Mhm.
what, and then there were more executive orders
Okay.
for the government to do certain things and so forth. There was no new executive order
Okay.
issued last week.
Okay.
So the second piece of this is what they said was, hey, we want more employers
Yeah.
to offer this benefit to their employees. So
And this is where
instead,
you and your work with Vital Voices Consulting is comes in. So I really want to
yeah, I mean,
amplify this.
and this is a program that actually Resolve has had for many years, because what's so amazing about people's stories and about
Mhm.
people's voices is that time and time and time again, it has been one employee who got some huge company to change their benefits and add IVF. So what I heard last week, and there's still a lot to be learned about this, is that they're they want to make it easier for companies to offer what's called a supplemental benefit for people who want that benefit. They can choose to jump on it and get coverage for fertility care. They didn't, they mentioned IVF, but it was kind of the full spectrum. And this is where I think perhaps the restorative reproductive medicine
Yeah.
might play a role.
Yeah. Yeah.
But a couple of things on this. I need to do a little more research. I don't know why we need this encouragement from the Department of Labor. I don't know why employers can't do this now. Like, I'm a
Thank
little
you.
confused about that.
Thank you. Well,
Um,
they can, right? Of course they can.
well, but here's the thing. Supplemental, so when I think of supplemental, vision and dental are not good examples, and that's the one that everyone's using, and I
Mhm.
I can get really wonky and talk about that. Think about the company Aflac. They provide supplemental benefits. It's like hospitalization. There was one I looked at that was cancer.
Mhm.
There's long-term care.
Right.
Like, you are an employee.
Mhm.
You are able to access these supplemental benefits because your employer has offered them. But truth be told, your employer's not paying for that, and you're doing it or you're not doing it.
Yeah.
And when the insurance could be car insurance, house insurance, how companies offer insurance is they are reducing the risk by spreading it out amongst millions of people.
Mhm.
When you have a supplemental benefit, you can have 5 people in a company. who
Right.
sign on to it, that's not spreading the risk, right? So the cost of that supplemental, whatever it is usually mostly on the employee,
Right. Right.
right?
I mean,
So,
at best, they might get a company discounted rate for
right, right.
supplemental insurance if they.
And you ask anybody in the insurance industry, and I
Mhm.
encourage anybody who's listening, maybe you got a friend who's a broker or somebody who sells insurance, ask them this question. Um, with something like a supplemental insurance, do you usually see it capped by a certain dollar amount, or is it pretty much you can do whatever you want? And guess what the answer is going to be? Oh, it has to be capped.
Of course. Yeah.
Guess what? The reason why vision and dental work is because they're capped.
Yeah.
You most most dental plans, I think it's capped at like $1,500. You get 2 free cleanings, but you like trust me, I have had a lot of dental work, as has my husband, and we're paying out of pocket for all
Yeah.
of it.
Exactly.
Because we hit that $1,500 a long time ago. So I just paid $600 for my contact lenses, and
Mhm.
I have insurance for vision.
Yeah.
So my point is that let's be careful. Supplemental could be open access for a lot of people who've never been able to even get anything.
Mhm.
But my fear is that it's going to be costly and there's going to be a dollar cap on that benefit because I don't know how else you sell a product
Right.
like that.
Right.
And so, I mean, I have a lot of cancer in my family. I remember I
Mhm.
looked at that cancer supplemental plan and I was like, this is a lot of money.
In
And
premium.
and
Mhm.
I'm not sure that this is what, yeah,
Mhm.
that I really should do this. The other thing about a supplemental is that you sign on when you company has open enrollment,
Yeah.
right? And so a lot of companies actually the
Right now.
fall right now, October, November, December.
Mhm.
So gosh, what if you find out in January you need IVF
Yeah.
and you just
You just whisk.
you
You just
gotta
whisk.
wait.
Yeah.
You gotta wait for. I mean, there's some practical things about this that I don't want to get be as I say be Debbie Downer, but I think as a field we have to. I wrote this. We have to be clear-eyed.
Yeah.
There's still a
Exactly.
lot to
And
understand.
that's why I wanted to have this conversation with you now, Barb, is that the languaging can sound very appealing and attractive. And oh wow, I'm going to pay 84% less. Oh wow, I can now get this supplemental insurance, and people aren't necessarily reading insurance pages, like right, they might read a declaration page, but they're not necessarily aware perhaps that they could be paying less if they pay cash pay than if they take the insurance 84% Trump RX reduction over the retail rate. I forget
I
what.
just had a I
Yeah,
just had a pit in my stomach, and I need to tell you why.
let's hear.
What if people hear this, and I'm going to put them in two categories: patients, and then um, um, companies who don't have anything to do, who are just employers, and then companies who are in, so three categories, and then companies who are in the fertility space.
Hmm.
If if the impression is we're done,
Hmm.
hallelujah, we've got coverage. My fear, Susan, is that people are going to stop advocating. People are going to hit the snooze button. People are going to stay on the sidelines. And employers are going to say, I'm going to wait a couple years to see what this is, and then I'll decide what I'm going to do. And
Well, my fear, Barb, is that is actually the point, the purpose. That's my fear. I mean, I'm not saying it is, but as I read all of this, I was like, oh my goodness, could this be a design to have everybody exhale, huzzah, say, oh, we're good, we're done, and then it would take time, right, before the reality hit, saying, oh wow, we just thought something was wonderful when it turns out it's not.
my husband has this saying. It's sort of like the magician, where you have one hand up here and then you have the other hand, and everyone's looking up here to see where the coin went when it
Hmm.
really was.
Hmm.
And I hope to goodness that that is not the case here, but I just want to be crystal clear
Yeah.
to anyone who's listening to this. Please, please, your advocacy is needed now more than ever. Do
Exactly.
not take this as a pass. Do not hit the snooze button or easy button.
Mhm.
We have to be louder than ever before.
Yeah. Thank you. And again, silver lining, like the moment is now, and the opportunity is now to say, okay, thank you for raising the awareness. Now let's raise our voices everywhere we can. And your voices and your stories, as Barb said, they are what is most compelling. We are human beings. When we hear someone's story, when I was at National Advocacy Day, I was bawling half the time because this is truly like life or death
Mhm.
experientials that people are sharing and going through. And so we all have a responsibility. I mean, clearly I am not in the fertility genre myself in terms of my own, but I have a 33-year-old daughter. She is. I
Mhm.
have patients. They are. We need to keep reaching back, reaching down, reaching out, because the collective, the need is there greater than ever before, right? We know the trends of infertility. Again, I'm grateful that restorative reproductive medicine is a phrase that's now being spoken about so that people can simultaneously, not for 6 months, not for 9 months, because you don't know what time you have, do what can be done to reduce toxic load, improve one's whole health, all of that.
Absolutely.
But right now is the time to reach out to Resolve, reach out to Vital Voices Consulting, and if that is appropriate, Barb, I'll put the link in
Yeah,
the show
yeah.
notes, because she's got blogs, she's got all kinds of information available, and I have been taking up so much of your time. I just took a look at the clock, and I promised you it was going to be in the 30-ish minute range. I've taken 45. As we wrap up, I want to make sure that if there's anything that you're like, oh gosh, but this is an important point. We can't leave without covering this. Please, the floor is yours.
Yeah, I mean, a way I would look at this is if you are somebody who is trying to build your family, and I would highly, highly encourage you to go to resolve.org. And that is going to be a tremendous resource. They are the patient voice, they are leading in the patient community, and they will tell you how to get involved and how to activate, to share your story and how to get, really involved in advocacy because it's scary. It's scary for everybody. If you are a company who is in the fertility space, you provide a product, a service, something to patients or maybe to providers, and you're really not doing anything, call me because it might be some baby steps, and I can help advise you on the how and the why and that sort of thing. And then if you're somebody who works for a company, in other words, you're an employee, maybe you're a manager, maybe you lead divisions, and your company isn't providing benefits to your employees, you don't have to wait. You can do it now. Again, resolve.org has amazing resources for both employees and employers, and you can do it now. And I was so proud at Resolve, we created model benefits, a whole process to just make this so easy. So quite honestly, there's ways you can get involved, and there's ways that don't take, a lot of time
Yeah.
and get you engaged in the
Yeah,
process.
you're not recreating the wheel, and you're not perhaps in that slice of pie. I don't know what I don't know. You're not missing crucial steps. There are templates for you to follow. And I'm going to add to the categories of people you were just speaking to. If you are a provider of any service in the fertility field, consider becoming a member of the ASRM, the American Society of Reproductive Medicine. We need to demonstrate to the population at large that we are arms linked on your behalf, on the behalf of the people who need our services. And there's also the Pacific Coast Reproductive Society. While it says Pacific Coast, there are folks from all over the country coming in. It's kind of like the younger sister, if you will, of the ASRM. And they also have a pretty active organization and membership, and an annual meeting as well. So it's not just the
Yeah,
one and
I
done.
mean,
If you can't make it to San Antonio this year, come to Rancho Mirage in California next March, and you'll
Well,
see many of the same faces.
and to your point on that, there are a lot of ways that providers, folks that work at companies in this space, you mentioned PCRS, the Pacific Coast, there's the Midwest Reproductive Society, there's the New England Fertility Society. So, I have found all of them, from ASRM to all of the ones, to be so patient focused and very much engaging with the patient community as well. So that's really good news.
Yeah.
But we need to do more.
Yes, amen. Amen. So share this, people, with someone you know and love, because again, 1 in 5 need your help. Rise up. This is, for so many reasons, where the opportunity to rise up, have your voice heard, be the change that you want to see in the world, that famous quote. Come join us, please. We need you. We need your help. We need your voices, and together we can make the change. So thank you, Barb, so much for being here. I think I'm going to have you back because, of course, it's an ever-changing field, and
I would love it.
your business is really, kind of like creating all new areas of growth and outreach. So yeah, looking forward to seeing you again. I'm so grateful. I know that you are a wanted woman, not on the poster kind of sense, but I really appreciate you taking your time to be with us today.
It was an honor. Great
Thank
conversation.
you.
Thank you.
Thank you. So listeners, viewers, thank you for your time. I know that your time is valuable, and to share it with us and is much appreciated. We don't take it lightly. We're grateful for your time and your contribution. And as we end every episode of Health University, where we're learning our lessons, we say class dismissed. Hey, thanks for joining us today here at Health University. If you want more episodes like this at Health University, you can find them wherever you get your podcasts. And make sure you subscribe to our YouTube channel so that you never miss an episode. If you have any thoughts or questions, please drop a comment down below. We'd love to hear from you. Thanks for watching, and we'll catch you at our next episode of Health University. But for now, class dismissed.